There are many different stressors that can arise in families. These are just some of the things that may play a role: substance-related disorders, domestic violence, and child abuse. And so Chapter 8 will cover some of these special topics. Some of the objectives will be discussing the nature, manifestation, and treatment of substance-related disorders, examining domestic violence in families, and discussing child abuse and neglect in families. Substance-related disorders present a significant challenge to families and societies. Substance-related disorders are even more destructive. Alcohol use disorders, alcohol abuse, a problem pattern where drinking interferes with work, school, or home life, in addition to other difficulties with the law and society. Alcohol dependency, the person is unable to control his or her drinking behavior, even after going to rehab maybe multiple times and having failed attempts at sobriety. Pseudo-individuation and pseudo-self may play a role. Manifestations of substance-related disorders in couples and families: shielding of the substance-related abuser by non-abusing members of the couple or family, denial, expression of negative feelings, deterioration, focusing energy on the substance abuser, and misusing family resources. Assuming survival roles: enabler, the spouse or other family member on whom the substance abuser is most dependent and who allows the substance abuser to continue and become worse. The family hero, an adult or oldest child who functions to provide self-worth for the family. Scapegoat, a child who attempts to distract the family focus away from the substance abuser by acting out in a disruptive manner. The lost child, the child who suffers from rejection and loneliness and offers a substance abuser family relief. And the family clown, often the youngest family member, who provides the family with humor and thus reduces tension. Individual manifestations: children may behave in confused ways about their self-identity and self-worth. Those who live with at least one parent who is an abuser of alcohol are twice as likely to develop social and emotional problems. They may feel less attached and bonded. Adults may spend lots of time and energy attempting to resolve issues related to the dysfunctional nature of their families of origin, and they may struggle in relationships. Substance-related disorder and treatment. Family treatments are among the most effective approaches for helping those with substance abuse problems. It's helpful to engage concerned significant others in the treatment process. Also, it's important to engage the most disengaged member of the family, possibly through a direct conversation. Approaches to treating substance-related disorder families after engagement. Using the community reinforcement approach, or CRA. Consider environmental influences. The theoretical basis for assessing is multisystemic therapy. Help with emotional, social, and vocational issues. Address feelings and defense mechanisms. Consider prominent theoretical approaches such as structural strategic, Bowen, behavioral, Adlerian, and multifamily therapies. Prominent theoretical approaches, as just mentioned: structural strategic, Bowen, behavioral, Adlerian, multifamily, or use of community resources and prevention. Domestic violence in families: aggression that takes place in intimate relationships, usually between adults. The willful intimidation, assault, battery, sexual assault, and/or other abusive behavior perpetrated on one intimate partner or another can take many forms: physical, sexual, psychological, and economic. Battering is violence which includes severe physical assault or risk of serious injury. Prevalence of domestic violence: approximately 1/3 of all married couples experience physical aggression. An estimated 1 to 2/3 of couples seeking marital therapy have had some incident of aggression in the last year. Although some men are the victims of abuse and violence by their mates, the large majority of those assaulted each year are women. Those who batter come in all shapes, sizes, classes, races, and sexual orientations or identities. Pit bulls are where heart rate increases as they become verbally aggressive with their partners. Cobras are when heart rate decreases as they become verbally aggressive. Again, these are just different ways of identifying. We're talking about types of abusers. 13% of all murders involve husbands killing their wives. 1.3 million wives are severely beaten by their husbands each year. And as you see, this was 2008. And so we do see these numbers connected still. Relationship between alcohol intoxication and domestic violence is high. And we see that domestic violence, a lot of instances occur when someone is using or under the influence of substances. Different ways that we assess domestic violence. There are some barriers legally, psychologically. It's difficult sometimes to determine the level and prevalence of violence. There may be a lot of shame related to that, a lot of secrecy, and a lot of fear because of threats that occur. There's common couple violence and then severe abusive violence or intimate partner violence. Just because one is called common, it doesn't mean that it's better or worse. It doesn't mean that it doesn't have a significant psychological and physical toll on a person. Open assessment often results in obtaining the most information. Blame is not a primary emphasis, and the therapist emphasizes that the expression of violence in the family hurts the entire family. The focus centers on dynamics within the family associated with family relationships, such as emotional expression, handling of money, sexuality, and social connections. Detection rates are increased when women are questioned directly, specifically, and alone. And so a lot of times this is done at an agency or organization where people feel that they can be open and where it's a safe space. Treating domestic violence, conjoint therapy involves seeing the couple together. The assessment of safety is required. 3 conditions must be met. Men's participation must be voluntary. And again, it could be a woman who's the perpetrator of violence. We also see violence perpetrated in same-sex relationships. So it's not always a man, but just looking at the couple being involved. And special agreement about confidentiality must be established. An optimal therapeutic stance must be achieved. Couple therapy may work if the following criteria are met. Only a history of minor and infrequent psychological violence or abuse has occurred. No risk factors for lethality are present. And the man admits, or abuser, not always man, admits and takes responsibility for abusive behavior and also demonstrates an ongoing commitment to contain explosive feelings without blaming others or acting out. So again, just know, predominantly we see men as being abusers, but it doesn't mean that females cannot abuse. And so just know, there's a disproportionality here, but I don't want everyone to assume that this is just the male's role that perpetrates violence. Treating domestic violence through intimate justice. The theory encompasses 3 ethical dimensions and 9 ethical concepts. It's akin to solution-focused approaches and confronts disempowerment and abuses of power in a partnership while challenging internalized beliefs about how one should treat one's partner. Through knowledge and insight, both behavioral attitudes and behaviors in couples may be modified. Educational treatment is an approach. Educationally, programs based on intimate justice theory and CBT have been employed with domestic violence family. The Duluth model is one approach. It's the ACBT model of treatment. It holds the premise that people learn violent behaviors because they're reinforced for them in cultural and social circles. People can unlearn these behaviors and learn new ones through cognitive behavioral means such as education. Child abuse and neglect in families. Child abuse, acts of commission. Child neglect, acts of omission. In 2010, Child Protective Services received more than 3.3 million reports of alleged maltreatment of nearly 6 million children. Each year, more than 1 million children are victims of child abuse. Abuse is seldom of one type, and we may actually even see underreporting. Effects of child abuse: aggression, delinquency, suicide, cognitive, academic, and psychological impairment, less satisfaction with life, and increased likelihood of behavioral, cognitive, and affective disorders. And these can also extend into adulthood. Child physical abuse resides on a continuum from mild to severe physical contact. Severe physical child abuse may include skin injuries to physical traumas and death, psychological consequences from fearfulness to post-traumatic stress responses. Child sexual abuse includes the following: unwanted touching, making sexual remarks, voyeurism, intercourse, oral sex, pornography. Boys are least reported, most commonly done by perpetrators outside of the family. 12 to 18% are sexually abused during childhood or adolescence. And again, this may be underreported. Girls are the most reported, but again, still may be underreported. They're most commonly perpetrated by a person within the family, and 1 in 3 is sexually abused by age 18. So again, just let that sink in terms of the frequent experience of childhood sexual abuse. Treating child abuse and neglect involves legal, developmental, and psychological issues. All states require mental health workers and other professional helpers to report child abuse and neglect. Failure to report child abuse usually constitutes unprofessional conduct that can lead to disciplinary action by a regulation board, possible conviction of a crime, and a civil lawsuit for damages. So again, there is responsibility of a mental health professional, specifically a licensed marriage and family therapist, to do no harm and to protect the interests of their clients, especially vulnerable clients like children. Family therapists must deal with many current and historical issues in working with child abuse. Important to concentrate on the following: assisting the abuser in learning how to delay acting impulsively, helping the abuser and the abused family members to recognize and select alternatives other than violence, and sometimes, to protect a child or protect family members, you may be working towards helping to dissolve a familial relationship. And a lot of times that may be because of legal reasons. Working with adult survivors of abuse, treat not only issues from childhood, but also adult behaviors associated with the past events. Understand the context in which the abuse occurred and realize that children are rarely abused in only one way. Treatment approaches may vary from Bowen-based family of origin work to behavioral interventions. A variety of treatments have been used, and it's very important to focus on the safety of children living in potentially violent environments. It's important to draw up a safety plan during the early stages of therapy and should include the following: a hotline or local police number, identified safe internal and external locations in case of violence. And so again, we could spend many lectures focused on these topics. They are complex, but the bottom line is that we are trying to do no harm and to promote safety and protection of vulnerable populations, because not only is there a great cost to children, but also survivors of these types of domestic violence and abuse.